Hi, my name is Josie, and this is the upper extremity screen. And some things that I would focus on is just purely observation, how their posture is when they're walking, their posture when they're seated, and also looking at their breathing. Are they breathing with their accessory muscles? Are they engaging their diaphragm and breathing through their belly? But also just generally look at vital signs, blood pressure, pulse. Movement testing specifically, what I would like to be focusing on is the top five of the functional test: cervical flexion, rotation, shoulder elevation, internal rotation, and external rotation. For this, I would expect deficits in the internal and external rotation with my diagnosis. I think he has limited mobility in his shoulders, and so he's compensating through his cervical spine and thoracic spine, and so that's why he has pain here and also in his shoulder. So I would expect some deficits there in internal and external. And I would also like to do the Cyriac selective tissue tensioning test, specifically to the shoulder to be specific, but I also would like to consider the cervical and the thoracic to help rule in and rule out where it's coming from. Generally, I would like to do the neuroscreen to make sure they're appropriate for therapy or if I have to refer them out. This would include the myotomes, dermatomes, reflexes, just a quick Hoffman's test, and some toe walking and heel walking. And then just to help me lead me to a certain diagnosis, I would do a stress test. I do compression and distraction through the cervical spine and the thoracic spine. I'm not really expecting to find any involvement here, as I believe the issue in and of itself is the shoulder, but it's still a good quick screen to do to then lead me into a different direction if needed. I'd also like to do palpation to make sure if there's any soft tissue involvement or some bony landmark involvement. The last thing I would like to do is a dural test. Um, However, I don't think there's any nerve and dural involvement, but it's always good to assess if we need to address it. This would be the last thing that I would do in the screen, as if there is involvement, it would light him up, and then the rest of the time would be an unproductive time. So I would specifically do the slump test, as it can isolate the cervical and thoracic spine from, the lower extremity.